Hello and welcome. This training is intended to provide guidance to New York State VFC providers on developing vaccine management plans. Each VFC provider is required to have routine and emergency vaccine management plans. The routine vaccine management plan should cover routine tasks associated with the storage and handling of vaccine. The emergency vaccine management plan should include information and instructions in the event of an emergency, such as equipment failures, power outages, and natural disasters. Vaccine coordinators are responsible for activating their emergency vaccine plan if the power outage is anticipated to be long-term, and/or if the temperature is rising despite storage unit doors remaining closed. When the power goes out, it is crucial that the vaccine storage unit doors remain closed with close monitoring of the temperatures on the external digital data logger display. Use the estimated power restoration time provided by the power company, as well as the temperature readings as your guide to activate your emergency vaccine management plan. It is recommended that a printed copy be located somewhere nearby the vaccine storage units for easy access during a power outage. Ensure that all facility, custodial, and security staff are aware of the location of the emergency plan and know the designated emergency staff contacts and procedures to follow if there are problems with vaccine storage equipment. The New York State VFC program provides an emergency vaccine management plan template that can be used to indicate emergency plan information for your practice. See the resources document included with this training for further information. It should be noted that vaccine management plans should be reviewed and updated annually. A routine vaccine management plan is comprised of the following sections: standard operating procedures, contact information for the vaccine coordinator and backup, staff roles, responsibilities, and training, and vaccine and diluent storage requirements and forms. Standard operating procedures should give instructions on various tasks related to the storage and handling of vaccine, including ordering vaccine and accepting vaccine deliveries, unpacking, handling, and storing the vaccine, monitoring storage unit temperatures, storage unit maintenance, addressing storage and handling problems, handling vaccines prior to administration, and disposing of vaccine and supplies properly. The routine vaccine management plan should also include current contact information for key staff and partners, including names, titles, phone numbers, and email addresses for the following: the medical director or equivalent, the primary and backup vaccine coordinator, the local health department immunization program, the New York State VFC program staff, vaccine manufacturers, vaccine storage unit maintenance and repair companies, and temperature monitoring device manufacturers, which includes information on device recalibration, technical support, and more. If applicable, the routine vaccine management plan should also include contact information for vaccine storage unit alarm companies and security companies. Your routine vaccine management plan should include descriptions of the roles and responsibilities for the vaccine coordinator and backup coordinator, along with the practice's staff education and training policies. This includes a listing of staff who handle or receive vaccines and the dates and titles of the required trainings they have completed. The required trainings are listed in training number 1 of this series. It is recommended that your routine vaccine management plan should also include storage unit requirements for each type of vaccine and diluent in your practice's inventory. Package inserts can be found on the Immunization Action Coalition's page via the link on this slide. The routine vaccine management plan should also include updated samples of specific forms used in your facility, such as screening forms, temperature logs, and stock records. The Centers for Disease Control and Prevention, or CDC, provides many worksheets and resources that can be used to develop your office's individualized plans. The links and resources on this slide provide additional information and examples of a routine vaccine management plan. New York State VFC providers are required to have an emergency vaccine management plan that provides guidance on what to do with vaccines in the event of an emergency. The emergency vaccine management plan should be updated at least annually and should include the following sections: standard operating procedures, emergency contact information, staff responsibilities, and a section on transport supplies, equipment, and procedures. The standard operating procedures and instructions section of the emergency vaccine management plan should include protocols for monitoring temperatures during power outages, along with vaccine transport instructions. There should be information regarding the location of transport containers and materials, including details of planned packing materials, and procedures on how to pack the vaccines appropriately. Logistics on how and where to transport the vaccines should be included as well. It is important to include your site's emergency contact information in your emergency vaccine management plan. These are the contacts that may be necessary to reach if the emergency vaccine management plan must be implemented. Examples of important contacts to include are listed on this slide. Staff should be aware of their responsibilities in the event of the activation of your emergency vaccine management plan. The primary vaccine coordinator or the backup vaccine coordinator designated in your provider agreement is responsible for making the decision whether vaccine relocation is necessary. These individuals must have after-hours office access. The vaccine coordinator or backup coordinator should be available 24/7 as the point person to contact the emergency relocation site to ensure it's prepared to accept the vaccines. The primary and/or backup vaccine coordinator are responsible to pack and relocate the vaccines. The vaccine coordinator may delegate duties to additional trained staff and may be noted on the emergency vaccine management plan as well. Include transportation procedures for both refrigerated and frozen vaccines in your emergency vaccine management plan. Your site needs to have appropriate emergency transportation supplies and equipment in place, including the materials listed on this slide. Instructions on how to utilize these materials appropriately to maintain the vaccine cold chain must be included in your emergency vaccine management plan. It's crucial to be ready before vaccine storage equipment failures, power outages, or natural disasters. These and other emergency situations can compromise vaccine storage conditions and damage your vaccine supply. It's critical to have an up-to-date emergency vaccine management plan detailing the steps you should take to protect your vaccine. Your emergency vaccine management plan must be tested at least once every 6 months and any time new staff are hired. Consider using this as an exercise in staff training. Contact information included in your practice's emergency phone tree should be updated quarterly and tested as part of the emergency vaccine management plan testing procedure. It is key that all staff know their roles and responsibilities before an emergency happens. Vaccine coordinators should activate the emergency vaccine management plan based on temperature stability in the storage units and the expected power restoration time. When activating your emergency plan because of an anticipated emergency, if possible, suspend vaccination activities before the onset of emergency conditions. This will allow sufficient time for packing and transporting the vaccines. In the event that there is no prior warning, an emergency event is occurring or has already occurred, follow these procedures only if safety permits. Notify the staff at the alternate vaccine storage facility before moving your vaccines to ensure their backup generator is working and to confirm transportation arrangements. Before transporting the vaccines, conduct a vaccine inventory, record storage unit temperatures, and document any actions taken. Also note if there were any water bottles in the affected storage unit refrigerators or freezers at the time of the event. Follow appropriate transport protocols as outlined in your emergency vaccine management plan. Vaccine transport is covered in more detail in training number 9 of this series. A vaccine tracking transport sheet must also be completed and emailed or faxed to the New York State VFC program. If vaccine temperatures go out of the acceptable storage range for any length of time, the VFC program must be notified immediately by contacting Vaccine Temp Excursion at health.ny.gov. The key messages for this training module are as follows. Vaccine management plans should be updated at least annually. There are a number of tools and resources available for you to use to prepare your vaccine management plans. The plans should be as detailed and easy to understand as possible and include all of the information outlined in this training. Keep vaccine management plans near vaccine storage units or in a central location where staff can find them. Make sure that custodial and maintenance staff are aware of the emergency vaccine management plan or at least know who to call if there is a problem. Post contact phone numbers for the primary and backup vaccine coordinators near the vaccine storage units. Vaccine coordinators and their backups are responsible for the emergency vaccine management plan when necessary. Lastly, the vaccine coordinator can designate other staff provided the alternate staff are fully trained. Thank you for your participation in this training on vaccine management plans. Any questions can be sent to NYVFC@health.ny.gov.